So we actually have, we did focus groups in Spanish with groups earlier on in December to get some of that information. I do think there is, and I'd have to look back at the data. We can share that with you if we have it, because I do believe it was public information. But I believe from Spanish-speaking individuals, there was a strong interest in getting the vaccine, so there was less vaccine hesitancy. I do think there was a focus of trust in terms of who is getting it. So I want to highlight East Boston's partnership with the Community Collaborative to bring vaccines to the population. So the linguistic capacity is there, the location is there. And so I think that's going to really address some of the barriers that have been first and foremost. I do think we need to get the word out more about some of our immigrant populations that ID and billing is a non-issue. I think that has come up multiple times. And so I think we need to really emphasize that with our communities. Excellent question. And so just so you know, in terms of communication, I didn't talk about it very much, but we have developed a communication plan to reach various communities. We have worked closely with MOIA to develop a communications plan for ethnic communities where we've identified healthcare professionals with various language capacity to provide this communication to our various communities, and we are working to identify a healthcare provider who speaks Haitian Creole. And I think part of the measurement is in being able to see how many people, we have the ability to look at race and ethnicity data. We also are getting feedback from certain specific community groups now that work with different populations to see, who is interested in vaccination. So we can go back to them and see how many were actually connected. I should mention that with Reggie Lewis, we have specific spots reserved for vaccination, so we can keep a finger on the pulse of how many people are connected to Reggie Lewis and by community group. So that's another way to measure. And we're also working internally just to think about, to your point, how are we actually measuring the success of a communication plan? So we have a communication team that's working on that as well. That's actually specifically why I mentioned the work that we've been doing with MOIA to identify healthcare workers. And we very specifically, I think we have identified a Haitian Creole healthcare worker to provide, this is somewhat of an abbreviated presentation for vaccine information. So a longer presentation and the ability to ask questions. So we do have FAQs translated into Haitian Creole. We have postcards that are translated into Haitian Creole. But to your point, I mean, really having that interaction is very important. So that as a toolkit can be shared with our communities. And so very good point. And we hear that and we know that as well. So it's implementing that. So that is in our plan hopefully in the next couple of weeks, not too far down the road.
Thanks so much, Dr. Lowe. And I just want to also emphasize that we have not only identified a Haitian healthcare professional, but also the Resiliency Fund has funded a number of immigrant partners to do webinars within the community with these healthcare professionals. And there are a couple of Haitian organizations that have been funding for that as well. I'll now, is any other questions for Dr. Lowe? I think. I
have a question. This is Janelle Alexi from Radio Eco Evangelic. Is there any consent form to be signed when you take the vaccine? Because there is a doctor who published a video saying it is like an experiment. If your workplace forces you to take that vaccine, you can put your own form and saying you are forced to take it, but that is something you're willing to do.
So anyone who receives the vaccine is required to sign a consent form. Moderna and Pfizer both have consent forms available in multiple languages. So you're required to know what vaccine you're receiving, and you're required to receive a information document and consent to be vaccinated. I cannot speak to whether organizations are requiring vaccines for their employees. I will say that there is no indication that the federal government or the state is going to require COVID-19 vaccination for its population at this time. So what institutions are doing individually is up to them. However, they definitely have, regardless of if institutions are requiring this, they need to adhere to the American Disabilities Act. And there are certain protections. So for people with religious exemptions or medical exemptions, they can be exempted from any requirements placed by our employees. And that's not just for COVID-19, that's for any medical requirement that an institution imposes. So I'm not sure about forcing, that is definitely not our goal, is to force anyone to get vaccinated. So I can't speak to individual organizations specifically though.
Now, is that optional, the consent form for both organizations asking, when you go to take the vaccine? Because I did check with people in my radio station, some of them want to take the vaccine, and they said they did not fill out any form.
No, the consent form is not, so if you are not willing to consent to receive treatment in a clinical facility or medical facility, they will not treat you. So maybe we can talk offline if they're specific, they went to specific sites, but yeah, the institutions will not, it's like you go into any health center, you must sign a consent form to receive care.
Because when I asked them, okay, there is that video saying you have to do this, you have to do that. And one of them told me I went for the vaccine, but I did not fill out any form.
Okay, maybe we can chat offline. I'm not sure. It'd be good to hear feedback.
Okay.
And sometimes there's electronic consent, so I don't know that's why I don't know the whole details. So yeah.
Any other questions? Go ahead, Lilian.
My question is based on my what I've been experiencing during this period, especially with the vaccination, because there's a lot of questions still out there. I see like a lot of work being done, and I've been lucky enough to participate in different groups that have been doing community studies and been listening to the communities. My question is there a specific effort that you're doing to combine information that is getting from these different sources that are going within communities, small nonprofits, different cities, and how is it being done? Like, because just to explain why my point in these questions is because I believe all those informations that are being gathering by different groups, they all have like the unique views, and if they are combined, I think we're gonna come up with amazing data, like to do all the materials that you're working on, like to educate, especially for education.
Yeah, so I think one of our goals at BPHC is to just ensure that the data is accurate. And so I think that's what people are really struggling with, is that there's so much information coming in through social media and just, news and whatever. And it's difficult to really sift through and what's real, just determine what's real or not. And so in our communications, we're trying to direct people to Boston Public Health Commission.org so that because we know that that's factual information, and we'll pull information from the CDC or from the state just to collate it that way so that it's trusted, and we update it as things come out and more questions come about. We do update it on a regular basis. So our goal is to try and direct people to a reliable source of information. And so, I mean, to your point, there is a lot of stuff out there, and I think we don't have the capacity to go through and say, yep, this is right, this is wrong, this is right, this is wrong. And so we're trying to have people come to, provide them the information so that they know, okay, this is trustworthy, this is reliable. Yeah, hopefully people will find it useful.
I think it is useful, and I think my point was kind of missed because I understand about the data. My point was like the questions out there. There's a lot of myths. We're talking about the Haitian community, for example. This amazing, this misconcept about the vaccines, and within the Portuguese-speaking community also. But those efforts are helping. But what I'm talking about is like the questions. There are questions that they're not average or common doubts that people have in their heads, because there's a lot of mystification. Yeah. And my point was like when you put the information out, the data is the data, right? There's no, but addressing all those other misconceptions that people have along the data when you put the information out there, so you can reach out to these people that don't look just at the numbers.
No, I know exactly what this has actually been a conversation that we have shared internally, is that should we be directly addressing the myths? And one of the risks of that is when you address a myth, you somehow make it real as well. And so it's a very careful balance, right? I think what had been brought up before by MCTV Boston is that we want to be able to be available so that people can ask those questions head on. And I do believe we've identified a Portuguese-speaking healthcare worker as well. So I think that might be something. I know Caitlin had said we can connect folks to do interviews, but I don't necessarily want to acknowledge the myths and then correct them, because I feel like that somehow empowers those myths as well. And we really just want to land to the facts. So yeah, I hope that addresses.
Yes, it does. And I also understand that you're not ignore it. It's just being addressed in a different level. But when it gets to you, we don't want to mix it. So I understand. It makes a lot of sense, because it's a very thin line between what you're trying to say that something is not, to end up reinforcing the idea. Okay, thank you.
Thanks, Lilian. I want to get just one more question. We have till 2:40 for Dr. Lowe. So any other questions?
I will go. Some people, they are questioning why the vaccine for COVID did not take too long to be ready versus other vaccines that maybe they're still working on took a long time.
Right. So I sort of alluded to this in the presentation. I mean, this is a global pandemic of unprecedented proportions, and so there were multiple resources, multiple organizations, just that focused on the vaccine at the same time to really push this through. And so when I say that the federal government was pushing it through, private industry, the vaccine developers invested billions of dollars to push this through quickly. And under normal circumstances, a Moderna type company will think of an idea, they'll go through the process, they'll raise funding, this takes years. So they didn't have to go through all the process. There was instantaneously, we are going to invest billions of dollars in the next 6 months. The federal government also did that. So a lot of that fund, the fundraising effort in just, garnering money did not have to do that process. The second point is that a lot of the folks, so mRNA, although the vaccine itself, mRNA, it's a new vaccine, mRNA, that the technology behind it actually has been in existence for many years to be utilized for cancer research and for cancer drugs and et cetera. So that technology actually is not brand new. It has been in existence. So that didn't have to be developed. That was already there. Another thing that often happens is that you need to pull in folks to complete clinical trials on. And so, recruiting and getting people to volunteer to do that, they actually used existing clinical networks. So again, these were all in existence. So under normal circumstances, a vaccine, you have to go through each of these processes and you do it, sequentially. And so all of these things were able to occur in over a 6-month period at the same time. So as an example, when I talk about the money, companies don't like to invest billions of dollars into a vaccine that may not come to fruition, but they did. And they, when I say invest, they also were producing the vaccine at the same time. So vaccine developers don't want to produce millions of doses of vaccine if there's a risk that it's not going to be approved, but they did. So as soon as Moderna was approved, I think it was like 2 weeks later that it was being shipped out. That is unheard of. That doesn't occur. It's because they had already been spent this last 6 months putting it into production. So, I mean, that's sort of a hurried response, but the idea is that it wasn't that there were any shortcuts taken. Everything occurred that normally has to occur, but it occurred at the same time. And I have to say that there are probably a lot of doses sitting out there not being utilized, either A, because they did not work, or B, they're still awaiting FDA approval, or they're still going through these trials. So our hope is that for instance, when Johnson & Johnson comes on board, normally if it's FDA approved, there's another 6 months to produce the vaccine for millions of people, but it will be ready within a week because Johnson & Johnson has already been producing. They already have a storage facility with the vaccines ready to go, just because of the investment that the country and these individual organizations have made in the vaccine development. So